Hello, everyone, and welcome to a session at the Town and Country SDA Church presented by our Health Ministries Department. I am Dr. Grace Levy-Clarke, and our topic today is hypertension. I've divided the talk into 3 segments. In the first segment, we will give a definition of hypertension, and we'll talk about how hypertension is diagnosed. Then I will look at the risk factors, and it's going to be divided into 2 sections: modifiable risk factors and non-modifiable risk factors. And then our third and final section will be the treatment of hypertension, looking at the different classes or types of antihypertensive medication. And as we talk about each class, I will give you some of the common side effects. We're going to be focusing on side effects that are common but not the life-threatening one. So things you might be experiencing at home that you think it could be the medicine, but we're not going to be dealing with any of the life-threatening complications. It's important to know, so before we go into the topic of medication, I wanted to do the introduction because I think it's so important that you understand what hypertension is so that you can understand what the blood pressure medicine is doing and why it is important to monitor your blood pressure. Hypertension is one of the leading causes of increased cardiovascular disease. And if we think about the cardiovascular system, we're talking about the heart and all of the blood vessels that supply oxygenated blood to the body and then recirculates the deoxygenated blood to the lungs, where it becomes oxygenated again back to the heart, and then it keeps that circle going. So what is your blood pressure? So as I said before, the cardiovascular system is made up of the heart and the vessels. So the blood pressure is actually a measure of the blood as it flows through the vessels. So it's an actual pressure that's measured. And this blood pressure is measured in 2 numbers. The top, or the first number, the health professional will tell you, is called your systolic blood pressure. It is usually the higher number of the 2. And what does it measure? It measures the pressure inside the arteries when your heart pumps the blood out. And then the second number is the diastolic pressure. That is when the heart is in the quiet or the resting phase. So you have 2 numbers, the systolic and the diastolic. What is a normal blood pressure? That's a very interesting question because many times someone will say to me, "Doctor, I don't have hypertension. My blood pressure is normal." So then I'll rephrase the question, "Do you take medication for your blood pressure?" And they said, "Of course." So your blood pressure is supposed to be normalized when you're on the antihypertensive medicine. But you should also, if you don't have hypertension, there is a range that we would refer to as the normal range. And this is changing, but right now I would say a systolic pressure of 120, and it's measured in millimeters of mercury, that's considered normal if it's 120 or less. But would you say you have hypertension just because it's 125 or 126? We will talk about that. And the diastolic pressure is considered normal if it's 80 or less. The recommendation is that you should have at least 2, and the operative word is at least. So you should have a minimum of 2 abnormal blood pressures measured at separate instances before you should be put on blood pressure medicine. So if you measure your pressure now during the screening, and then we do another screening in a month, and both times you find that it's abnormal, that is enough for you that you should get it checked. So 2 abnormal readings at least. So what are some of the risk factors for hypertension? I think it's so important to understand these, and I've divided them into the non-modifiable factors first. In other words, these are things that you're just not able to change. So right away, you're starting off with 3 things that you cannot change. And I think that is so important to understand. What do we mean by your family history? It means that if anyone in your family, your mother, your father, your siblings, your grandparents, your uncles, your aunts, anyone in your family that is treated for hypertension, that is counted as a risk factor for you. The next one is your ethnicity. And usually, we believe that anyone with an African heritage will have a higher chance of getting hypertension. And then the final one is as we age. So your chances of getting hypertension increases the older you get beyond 60 years old. And the reason is, as we get older, the vessels become thicker and stiffer, less flexible, meaning that the heart has to pump so much harder to get a flow of blood through the vessels. What about the modifiable risk factors? So if you're in the childbearing age and you're taking contraceptives, if you use the estrogen-based contraceptives, it is believed that those can cause you a higher chance. It increases your risk of getting hypertension. And I specifically did not put oral contraceptives because you can also get implantable contraceptives. So any contraceptive that has an estrogen base, it can increase your chances of developing hypertension. The second modifiable risk factor is your cholesterol. High cholesterol can cause plaque to build up in the vessels, and again, it's just harder for the blood to flow through the vessels when it's plaqued. Obesity, stiffer inflammatory reaction causing the development of atherosclerosis, again, thickening of the walls, making it more difficult for the blood to flow through. Diabetes, fatty deposits within the vessels because of diabetes, and we see that throughout the body, especially the susceptible organs are what we call end organs, the eyes, the kidneys, and the brain. And that is why you can get blindness, loss of kidney function, and heart attacks and strokes. Smoking can also cause plaque to build up in your vessels, and anything that decreases the lumen of the vessels will cause hypertension. And then finally, and interestingly, lack of exercise. So if you're very sedentary, if most of the time you have to be sitting, it can really cause, again, buildup of plaque in the vessels, and that can lead to hypertension. So it's good that you have at least 5 or 6 things that you have control over, because you can't control your ethnicity, your age, or your family history. So now you have other things that you can control: obesity, diabetes, smoking, and exercise. So we've talked about what is hypertension, how it's diagnosed, what are the risk factors. Now we're going to talk about the complications, because I think it's really important to understand not just what your blood pressure medicine is doing, but why you need to take it. And for me, I would have to say the number one thing is it can cause a stroke. So we talk about a TIA, a transient ischemic attack. A lot of people will call that a mini stroke. So it's truly not a small stroke, it's a short stroke. It's truly a stroke. So it's a time period in which the blood is not receiving any oxygenated blood. When the brain is not receiving any oxygenated blood. And it can be quick. It can be just a few seconds or a few minutes. There are people who it can last up to an hour. And many times what will happen is, many times the symptoms will be, I just had this blurry vision. My vision went dark and then it didn't come back for about 5 minutes or half an hour. The reason is because when the major vessel leaves the heart, excuse me, to go to the brain, one of the first major vessels is going to be the vessel to the eye. So if you have a decrease in the flow of oxygenated blood up to your brain and it starts to slow down, you're going to feel it in your eyes very quickly. So many times the patient will come in and they'll say to me, I had a stroke in my eyes. So a stroke in the eye is when something blocked the vessel, and it doesn't have to be just hypertension. Again, this can happen because of high cholesterol, atherosclerosis, diabetes. So anything that decreases the ability of the blood to flow to the organ, such as the heart, or the eyes, or the kidneys, or the brain, hypertension is a big culprit. And then you can have a full-fledged stroke, which is a cerebrovascular accident, meaning you had a prolonged period when the brain was just not oxygenated. Hypertension can also cause the heart to enlarge. And that makes intuitive sense, right? If the vessels are so narrowed, the heart is going to overwork to get the blood through the vessels. So for me, I'm very visual. What I suggest that patients do is close your eyes and visualize that really the heart is just a pump. It functions to send blood all over the body. And if all of those vessels become narrowed, you're going to have to push so much harder. It's like trying to drink with a straw versus just putting the cup to your mouth. That lumen, the opening, the vessels need to be open and patent. If they're not, then the heart is going to work so much harder. So you can get a stroke, You can get an enlarged heart, and then eventually the heart will overwork and you end up with heart failure. So heart failure is different from a heart attack. When you have heart failure, the heart is just having difficulty moving the blood through the vessels. Whereas a heart attack is when the actual vessels that supply the heart itself, those arteries gets blocked, and that is when the muscles in the heart basically are going to stroke off. So a heart attack has to do with the muscles of the heart. Heart failure is the ability of the heart to pump the blood around the rest of the body. Hypertension can also cause peripheral artery disease, and most of the time it's going to be in the lower limbs. You can also end up with an aneurysm. Why? It's because the vessels, the pressure of the blood moving through the vessels gets so high that they balloon out. That's what an aneurysm is. It balloons, and some of that blood now can sit in that pocket, and when the pressure of the blood moving through it, it can literally rupture. So you can develop an aneurysm anywhere the vessels become incompetent due to increased hypertension or other types of anatomical reason. But most of the time, when you end up with a stroke, it's because you've developed aneurysms in the brain, and you can get what we call a hemorrhagic stroke. So that blood vessel literally bursts and bleed into the brain. But you can have aneurysms all over the body. Another place that people get aneurysm is in the abdomen. So an abdominal artery can really get overworked, and you can end up with an aneurysm. Kidney disease. The vessels that are going to the kidney, if they become compromised and the kidney is no longer able to function, hypertension is one of the causes of end-stage renal disease, so hypertensive nephropathy. And then the eyes. You can develop veins in the eyes that will simply burst. So you can have what we call a vein occlusion. Because of the hypertension, the vessels, the veins in the eye can burst, bleed into the eye, and compromise the ability of the retina to function. Then you can also have the opposite. Hypertension can cause the arteries to become occluded. So if you have an artery occlude in the eye, which is what we call that stroke to the eye, you have 90 minutes. After that, it's irreversible. So you can go blind from that. So when we think of hypertension, we're thinking of the heart functioning to pump blood all over the body, and every single organ can be damaged by hypertension. So every time you feel like you're gonna miss your blood pressure pill, think about your heart, think about your brain, think about your kidneys, and think about your eyes. All of the organs that you need to be able to function with.